Question: how is biosoluble curcumin different from regular curcumin? The simple answer is night and day. Curcumin is one of the most difficult supplements for the body to absorb since it greatly resists dissolving in water. As a result, usually the best a curcumin capsule can deliver is less than 40 nanograms per milliliter of blood. That is very little. However, biosoluble curcumin is enveloped in whey protein, which both makes it highly soluble in water and allows it to pass readily through the intestinal wall into the bloodstream, producing yields per capsule of 1,000 nanograms per milliliter. Not 40, 1,000 nanograms per milliliter. Also, it tastes good, whereas regular curcumin is very bitter. Again, Bio-Soluble Curcumin or CURCUMINPRO Complete dissolves in water. Other brands don't. An added big plus is that Bio-Soluble Curcumin contains no BIOPERINE. More on that later. Question: how come CURCUMINPRO tastes so good when other curcumin products are extremely bitter? Answer: Bio-Soluble Curcumin or CURCUMINPRO envelops the actual curcumin in whey protein, so your taste buds never come into contact with the curcumin, which is indeed very bitter on its own. Question: bioavailability versus assimilation. These terms are pretty much used and misused interchangeably. Bioavailability and assimilation both describe the extent to which nutrients from diet are absorbed and utilized by the body. The terms are frequently misused in supplement advertising because the products being touted, although they may be absorbed, often may not be utilized at all by the body. The first question asked is if the supplement can pass through the intestinal wall into the bloodstream. If not, then its nutrients are not being absorbed. This is usually the case for curcumin supplements. Few get absorbed. Some of these products still claim to be bioavailable, even when they're not even being absorbed. The next questions to ask are these: are the nutrients being utilized? Are the supplements soluble in water? Do they dissolve in water? Solubility of curcumin is critical because the male human body is 60% water, the female human body is 55% water, bones are 31% water, skin is 64% water, the heart and brain are 73% water, and muscles and kidneys are 79% water. If a supplement does not dissolve readily in water, it will be very difficult for the various parts of the body to use it. Biosoluble curcumin is the only form I know of which is highly soluble in water and readily utilized. Studies have shown that biosoluble curcumin even passes through the blood-brain barrier, which would allow for the curcumin to be more helpful with Alzheimer's and dementia. Remember, supplements ingested but unable to be absorbed and utilized during the digestive process are of zero nutritional value. Zero. Question: what is black pepper extract or BIOPERINE? And why do people say you have to have BIOPERINE and curcumin to make curcumin work? This is a view espoused by some medical professionals, and it reminds me of cigarette ads from the 1950s like this one. Even medical doctors can be wrong, and those recommending curcumin with BIOPERINE are both misinforming and endangering the public. Yes, endangering. BIOPERINE does help curcumin pass through the intestinal wall into the bloodstream, but at a significant cost. BIOPERINE harms the intestinal lining, making it more porous by destroying gastric cells, which can lead to bleeding in the gastrointestinal tract. That's why unwanted side effects of BIOPERINE include stomach ache, acid reflux, constipation, loss of potassium, nausea, and even allergic respiratory reactions. Yes, curcumin molecules do pass more easily through a damaged GI tract and enter the bloodstream, but so do a host of other toxins. The infamous leaky gut syndrome. Those toxins which enter the bloodstream must be detoxified by the liver so they can be excreted out of the body. Adding insult to injury, BIOPERINE shuts down the functioning of CYP3A4, an important liver and small intestine enzyme, as well as a vital protein, human P-glycoprotein. Both of these are crucial to the liver's ability to break down and excrete the very toxins which BIOPERINE lets enter the bloodstream. Even worse, BIOPERINE blocks the action of the CYP3A4 enzyme in the small intestine and the liver. the body's natural way of breaking down more than half of the medications commonly taken today. Think about that. There's an enzyme that helps the body break down drugs, but BIOPERINE prevents that enzyme from working. Taking as little as 10 milligrams of BIOPERINE a day prevents the breakdown of drugs such as lovastatin and other statins, antibiotics including adriamycin, opioid painkillers like oxycodone, sleep medications such as Ambien, hormone regulators including tamoxifen, and many, many others. Would you knowingly take 6 or 10 times more of your prescribed daily dose of such medications? Again, that can be the effect of taking as little as 10 milligrams of BIOPERINE a day with your drugs. This blocks their breakdown and excretion so the drugs stay in and build up in your system. Serious negative side effects can and do result. Ironically, one prominent seller on Amazon of curcumin with BIOPERINE boasts that each of its capsules contains 10 milligrams of BIOPERINE. That is medical insanity. I don't recommend it at all. Question: what are the health benefits of biosoluble curcumin? Since I don't have 2 weeks to read to you literally hundreds of peer-reviewed studies on this subject, I suggest instead that you visit my website, www.hkacp.com. That's www.hkacp.com. Click on our acupuncture and TCM courses. Scroll down until you get to the courses Why Curcumin is the World's Most Used Herb, and also Curcumin to Treat Cancer and Benign Tumors. Download those courses. They're completely free for you to read. When you download the courses, you can read summaries and references to research on curcumin, which documents that it is helpful for the following conditions. Any problem arising from inflammation, since curcumin is strongly anti-inflammatory, and pain is a condition of an inflammation. So curcumin is very, very helpful for pain. Curcumin is very helpful for Alzheimer's and dementia, arthritis, asthma, cancer, chronic traumatic encephalopathy, diabetes, dysmenorrhea, that's painful menses, and PMS, fluoride toxicity, which hardens the pineal gland, heart disease and hypertension. Curcumin really helps blood to flow. Hyperlipidemia and obesity, kidney disease, liver disease, osteoporosis, Parkinson's, stroke, and thyroid disorders. However, there are some precautions. 1. Since curcumin helps blood to flow so effectively, do not take it if you're already on Coumadin, Plavix, or any other prescription blood thinner. 2. Also, most curcumin can bind with iron in the gut, leading to iron deficiency anemia. Thus, avoid curcumin which is not enveloped with whey protein. Question: what is the right amount of curcumin to take, and when should I take it? I recommend that my patients in pain take 2 capsules every 8 hours, since this stays in the body for 8 hours. Take 2 upon waking, 2 8 hours later, and 2 before bed. When pain is severe or if there's a more complicated medical condition, I tell them to up their dose to 3 capsules every 8 hours. Generally, I personally take 1 capsule 3 times a day, every day. However, a month ago, I injured my back. I was recently lifting a 350-pound iron object, putting it into a wheelbarrow, and then I tried to push the wheelbarrow 100 feet. Well, I did get it 100 feet, but then I developed severe back spasms, intense back pain. I upped the dose to 4 capsules every 8 hours, and by the next day I was much relieved. So I personally use curcumin all the time, and if I'm having any pain condition, I definitely up the dose.